Anxiety disorder is a mental health condition characterized by persistent feelings of fear, worry, or unease that are excessive or disproportionate to the situation at hand. These feelings may manifest as physical symptoms such as sweating, trembling, rapid heartbeat, and shortness of breath. Anxiety disorders can include a range of conditions, such as generalized anxiety disorder, panic disorder, specific phobias, agoraphobia, social anxiety disorder, and separation anxiety disorder. These disorders can significantly impact a person's daily life, making it difficult to carry out normal activities or interact with others. Treatment for anxiety disorders may include therapy, medication, or a combination of both. Generalized anxiety disorder, GAD, is a mental health condition characterized by persistent and excessive worry and anxiety about everyday events and activities, even if there is no apparent reason for concern. People with GAD may worry about various things, such as work, finances, health, family, or personal relationships. This excessive worry often interferes with their daily life and may be accompanied by physical symptoms such as fatigue, irritability, muscle tension, difficulty sleeping, and restlessness. GAD can be diagnosed by a mental health professional after a thorough evaluation and assessment. Treatment for GAD may include therapy, medication, or a combination of both. Panic disorder is a type of anxiety disorder characterized by recurrent and unexpected panic attacks. Panic attacks are sudden and intense episodes of fear or discomfort that can last for several minutes and can be accompanied by physical symptoms such as palpitations, sweating, trembling, shortness of breath, and feelings of impending doom. People with panic disorder often worry about experiencing another panic attack, which can lead to avoidance behavior and impact their daily life. Panic disorder can be diagnosed by a mental health professional after a thorough evaluation and assessment. Treatment for panic disorder may include therapy, medication, or a combination of both. Cognitive behavioral therapy, CBT, is an effective treatment for panic disorder, which aims to help people identify and change negative thought patterns and behaviors that contribute to panic attacks. Medications such as selective serotonin reuptake inhibitors, SSRIs, and benzodiazepines may also be used to treat panic disorder. Specific phobias are a type of anxiety disorder characterized by an intense and irrational fear of a particular object or situation that poses little or no real danger. Common phobias include fear of animals, such as spiders, snakes, or dogs, heights, flying, enclosed spaces, and blood or injections. People with specific phobias often go to great lengths to avoid the object or situation they fear, which can significantly impact their daily life. Exposure to the feared object or situation may trigger an immediate and intense anxiety response, which can be accompanied by physical symptoms such as sweating, rapid heartbeat, and difficulty breathing. Specific phobias can be diagnosed by a mental health professional after a thorough evaluation and assessment. Treatment for specific phobias may include therapy, such as cognitive behavioral therapy, CBT, or exposure therapy, which can help people gradually confront and overcome their fears. In some cases, medications may also be used to treat specific phobias. Agoraphobia is a type of anxiety disorder characterized by an intense and irrational fear of being in situations where escape might be difficult or help might not be available in the event of a panic attack or other distressing symptoms. People with agoraphobia often avoid certain places or situations such as crowded places, public transportation, and open spaces, or they may require a companion to accompany them. Agoraphobia can be a debilitating condition that limits a person's ability to carry out daily activities and may lead to social isolation. It often develops as a complication of panic disorder, but it can also occur on its own. Agoraphobia can be diagnosed by a mental health professional after a thorough evaluation and assessment. Treatment for agoraphobia may include therapy, such as cognitive behavioral therapy, CBT, or exposure therapy, which can help people confront and overcome their fears. In some cases, medications such as selective serotonin reuptake inhibitors, SSRIs, or benzodiazepines may also be used to treat agoraphobia. Social anxiety disorder, also known as social phobia, is a type of anxiety disorder characterized by an intense and persistent fear of social situations or performance situations, where a person is afraid of being scrutinized, judged, or embarrassed in front of others. This fear can be so intense that it interferes with daily activities, such as attending social events, participating in group activities, or even performing routine tasks in front of others. People with social anxiety disorder may experience physical symptoms such as sweating, trembling, blushing, and rapid heartbeat. The fear of social situations can lead to avoidance behavior and may negatively impact a person's personal and professional relationships. Social anxiety disorder can be diagnosed by a mental health professional after a thorough evaluation and assessment. Treatment for social anxiety disorder may include therapy, such as cognitive behavioral therapy, CBT, or exposure therapy, which can help people confront and overcome their fears. In some cases, medications such as selective serotonin reuptake inhibitors, SSRIs, or beta blockers may also be used to treat social anxiety disorder. Separation anxiety disorder is a mental health condition characterized by excessive and developmentally inappropriate anxiety about being separated from a person to whom a child is emotionally attached or from their home. This disorder is typically diagnosed in children, but it can also occur in adults. Children with separation anxiety disorder may experience extreme distress when they are away from their parents or caregivers, or when they anticipate being separated from them. This distress can lead to physical symptoms such as headaches, stomachaches, and nausea. Children with separation anxiety disorder may refuse to attend school, avoid sleepovers, or require a parent to be present at all times. Treatment for separation anxiety disorder may include therapy, such as cognitive behavioral therapy, CBT, or play therapy, which can help children learn coping skills to manage their anxiety. In some cases, medication may also be used to treat separation anxiety disorder.